Okay, so what we're going to have a look at now is how to use bony prominences in massage to increase the depth and the pressure that we can achieve, but at the same time being acutely aware of the problems that one can have in terms of sensory feedback. So when we're using the palms of the hands, the fingertips and so on, we've got very good sensory feedback and therefore our palpatory skills are quite heightened. Once we move to using bony prominences, we're going to get a lot less sensory feedback coming back to us, so we need to be much more cautious. The other thing that we will need to pay attention to is our posture, so that we're not leaning too much over the client and therefore not controlling the amount of pressure that we put on. So it's important to mention that when we use these bony prominences, we've already done a lot of preparatory massage on that area of tissue first, and that we're well aware of the condition of the soft tissues before we get in to use these deeper techniques. So an example, first of all, if we assume that we've done all the preparatory techniques, I may switch to what we call a thumb rolling technique, and I'll just do this very slowly. First of all, up the middle of the calf, and we're just using the ulnar borders of both thumbs, just stroking with venous return. And in the initial stage, all we're doing is using this very much as an exploratory tool. So the idea will be that I will run up an area of tissue where I suspect there is tightness or sensitivity, and I'll go into a certain depth, checking with my client at all times for any discomfort. If on the first passing to a certain depth and pressure I find that I get no response, I may then return and get in a little bit deeper and again work my way up the muscle. So at this point it becomes a kind of diagnostic or an exploratory tool. Then we can convert it to a treatment tool as well, and if we find, for example, a tight strand of muscle tissue as often runs the whole length of a muscle, we can then use this as a means of deep stroking over a very finite area of tissue, trying to stretch out those individual fibers. So we'd be working with venous return, make sure that we're not putting any pressure on the valves, and working our way up the muscle like so. So just to recap, we would use that selectively, first to explore and then to treat. We wouldn't randomly use that all over the muscle. If we then wanted to progress to other forms of using bony prominences, my preference is to use the back of the hand, and very much, first of all, the back of this area here, not so much the knuckles. So I rest the hand like so and just glide up the back of the calf, selecting the area for this deeper stroking technique. How's that pressure?
Yeah, good.
Okay. And of course, if I want to, I can switch to a two-handed technique. Again, just being careful, eliciting feedback. So can you just tell me if any of this at all produces any discomfort or it's too much pressure? Just tell me, okay?
Okay.
And then a progression on from this stage. I'll just show you that on the hamstrings first of all. You can see sort of marks that we leave immediately after where the blood flow is affected. So you can see the sort of depth of the technique that we're using. And again, I'll just show you one hand. So you can see, although I'm leading with this set of knuckles, it's very much that part of the hand that is just stroking deeply into the muscle. So these are graded progressions, getting deeper and deeper. If I want to increase the pressure further, we use what we call a cam and spindle, and this is really a way of A, controlling the lateral movement over the calf or the hamstrings, and B, the depth of pressure. So if, for example, I'm going to target the lateral part of the calf first of all, I would lay my hand like so, put my thumb inside the hand like so, and then just clamp around it. This provides a nice guide down the medial side and stops any lateral movement, but it also helps me control the pressure, because now instead of just gliding, I'm going to roll and very definitely use the knuckles rolling into the tissue. So Kat, can you feel the additional pressure there? Is that okay?
Yeah, that's good.
Okay. So if I can just show you how that's just rolling away. I'm starting with the pressure here and finishing up with it on those knuckles there. If I switch to the medial aspect of the calf, again what I would do is just lay the hand down, thumb goes in there, clamp around that, then I've got my guide and I can just roll away, doing exactly the same technique but to the medial aspect of the calf. And again, you can do the same onto the hamstrings. Is that okay? And this can be as controlled and as deep as you and your client will be happy with. Switching to lateral, lay the hand down, thumb goes in, and away we go. Just be discreet with the guide hand, obviously working up the medial thigh. So I'm just angling that slightly so that my client's comfortable with that position. Okay, and then the final stage, again a means of getting still more pressure, is to use the ulnar border of the forearm. And for this, what I do is lay the forearm down on to the area that I'm targeting. You can stabilize the wrist if you want to, adjust your posture and your stance, and then what I tend to do is roll the ulnar border away from me as I apply a deep stroking technique to the affected area. How's that pressure?
Good.
So I'm being much more cautious and being quite deliberate about getting more verbal feedback from my client here, because the sensory feedback is not so great in terms of me being able to judge what is good pressure for my client. I have to rely much more on them at this stage. And just use sensibly the arm that provides the least rotation in your spine. You can perhaps see if I do that with the other arm, there's a lot more torque in my back. Not such a good method to use. And then from here, working up the hamstrings. To use your lower body just to lunge forward, so you can go with that movement and stretch like so. So hopefully that will provide you with some additional techniques for getting in deeper and really satisfying a client that needs deeper massage techniques, deeper stretches and so on, and obviously good control at the same time. Okay. Right, let's stop those for a second.